Dr. Kevin Kavanagh is with us this morning. He is a retired physician, also founder of a national organization called Health Watch USA, and we're getting closer to the big to-do that your organization is having. Why don't we start with that? What's going on, and when is it going to happen?
Well, it's going to be on June 15th, which is a week from Tuesday, and it's a large international infectious disease conference, a webinar, free of charge, and we're going to have a number of really nationally renowned speakers from around the world talking about what they're doing in their country to respond to COVID-19. And this, I think, will give us a really good view of what other nations are doing. And I can tell you, Jack, we're one of the more lackadaisical responses of all the other nations. Even the UK is much more vigilant than what we are. For example, in areas that they have the Indian variants, they're recommending having their population being tested twice a week. So we are somewhat behind, and I think it would be good for people to log on and listen. Go to healthconference.org, that's healthconference.org, and register, and we'd be more than happy to have you all in attendance.
And that's free.
And we also have Dr. Carolyn Clancy, who's the Deputy Secretary for the Veterans Administration, talking about their response and their fourth mission, which has to do with aiding the public health response to pandemics in the United States.
Very good. That sounds great to me. You've heard, no doubt, the, criticism you'd call it in the last couple of days to Dr. Fauci. Can you address that, what people are accusing him of, and what you think the truth is?
Well, I'll be happy to. I think there's two main items. One are the masks, and the other is the Wuhan Lab. The masks, I don't think there's any discrepancy between what the emails were and what his public statements were. But as you know, Jack, our group disagreed with the federal policy on masks early on and came out even before the CDC that we should be wearing masks. And a lot of the disagreement and the problems of flip-flopping with masks had to do that this was a new virus. We were still learning how masks work and how this virus acted. And what flipped everybody between not wearing masks and wearing masks was when we found out the virus could spread by asymptomatic carriers. And remember, we were advising people at that time that the mask is not so much to protect you, but to protect others. And then we started to learn more how masks work and that this virus was aerosolized. Unfortunately, aerosolization really wasn't talked about much until just a few weeks ago, but we were talking about it back in August of last year. And with an aerosolized virus, that is much harder to stop. And then we started to learn more about how masks work and how aerosolization works. And this is really new information. Before, let's say in 2019, we used to think about large particles and little viral particles. Now, that's no longer the case. We know that there's a huge continuum of particles, and some of the larger particles can actually aerosolize. And this would be the smaller droplets between about 10 to 100 microns that are produced by speech. And those tend to be the particles that appear to be spreading COVID-19. Cloth masks, if they're well constructed, well fitted, don't have vent holes between the face and the mask, multiple layers, will give you some protection. Not as good as an N95, but will give you some protection. And so that's when cloth masks were really started to be advocated for wearing. And that's really kind of a progression of how our science evolved. And I've learned a lot over the last year about masks as more and more research came out. And I think that the public needs to embrace them, because one of the things that I think that we've all noticed is that last year we haven't been as sick as much with flu, colds, etc. And that's because we started to pay attention to spread of airborne pathogens, wearing masks, not coughing on others, not going around people when we're sick. And these type of activities, along with increasing in building airflow, ventilation, and safety, I think will progress even after the pandemic. And those, I think, will be good changes.
What about the Wuhan Lab?
The other big criticism is, of course, the Wuhan Lab. And that gets harder to really dive into. When I was asked about this last year, as you know, I wouldn't commit one way or the other because I didn't think we had enough information. And I think from reading the emails And also looking at the statements, I think a lot of those are just work products. You need to realize Dr. Fauci heads up the NIH for infectious diseases, and that means that he's the research arm. Really, Wuhan Lab, I think, is more national security. Most of the advisements going in early on in the Trump administration were through national security agencies. And when you start questioning whether or not we've been attacked, or either deliberately or whether there was gross negligence by a country that makes up a third of the world's population, those conversations probably need to be done at a higher level than Dr. Fauci and behind closed doors. So I'm not too really disturbed about that, and I think we've discussed that early on. Now, he did fund through the NIH about $600,000 that apparently eventually wound up into the Wuhan lab. Now, that may seem a lot to you and me, but when you look at NIH budget for emerging infectious diseases, it's about $3 billion a year. An R01 grant is $3 million, not billion, but $3 million a year. The total funding of the NIH for emerging diseases is $3 billion. And so it becomes a small portion. And from what I understand, this was a grant that went to a nonprofit that then subcontracted some money with the Wuhan lab. Now compare that to some of the articles which have been coming out in the literature. And one that's most concerning to me was one that was published in September that involved both the Chinese research arm of their country plus the WHO doing gain-of-function research. And believe me, over the years, we've pumped in tons of money into the WHO. Now, gain-of-function research does not mean they're making a military weapon. They just could be possibly trying to make a virus that is really strong so that they can make a vaccine to it and see all its variations so they can come up with a cure to knock it out before it emerges from the wilderness. But if you're doing that, you don't want the virus to emerge from your lab. And so, yes, I think that there's probably some problems there, but I'm not really sure Dr. Fauci is the right person to be aiming your gun at with that problem of the Wuhan lab and our response to it.
I guess just because he's been the face of the medical side or the scientific side, that the only one that we've really seen consistently through all this, he's the one that's going to take the heat.
Well, yes. And believe me, there was tremendous pressure last year about the Wuhan lab. I mean, I had this article in September. I sent it to our senator's office. I was trying to get it published in some articles and journals, and they were turning it down. You know, you couldn't say anything about the Wuhan lab saying that, hey, there may be some concerns here without being accused of being racist. And I'll just come out and say it. I mean, it was tremendous pressure. And this included on President Trump. I mean, every time he tried to bring up the subject, he was beat to death. And so, well, yeah, so was Fauci and so was everybody else. But it was really a subject that should have been brought up behind closed doors with National Security Council and with kind of the top national security planners rather than the head of the department of the NIH responsible for funding grants to try to come up with cures for infectious disease. And that to me doesn't make much sense. And I should add now that no one knows for sure where the virus came from. It could have came from nature skipping over to man, or it could have escaped accidentally out of the lab. No one really knows. I was just talking about one of the two possibilities. I think what people have concluded is it's highly unlikely that this is a bioweapon. As I said before, this isn't the type of virus you would make as a bioweapon because it would mutate and come back to haunt you really quickly. So that would not have been a good decision. But as far as a lab accident, I think that's still on the table.
You sent me an excerpt of a piece this morning, a report on myocarditis rarely occurring after vaccination. You want to go into that a bit before the break?
Well, yes, and that's something that's starting to pop up more in the news media, but it's extremely rare compared to myocarditis after COVID. Remember, we were talking about that last year, that even the young kids were frequently developing this. Some reports maybe 5%, some reports 30%, but nevertheless, it's more than 6 or 7 children out of hundreds of thousands that have had the vaccine. So by far, the vaccine is much, much safer than COVID. One of the problems we have is that COVID-19 affects every organ of the body. It is not just a respiratory virus. and even those with mild symptoms and illnesses can still develop long COVID and do it at a fairly large percentage. Now, I'm not talking about 80%, but some studies are looking at 10 to 30% of people having lasting symptoms. So we need to respect the virus and we need to get vaccinated. That's our ticket out of this.
Lane?
Yes, I'm sorry, I'm going to botch the word myocarditis. What is that?
That's inflammation of the heart. And COVID can affect the heart in a number of different ways. One is through just making the blood more coagulable. In other words, give you a heart attack. It can coagulate some of the small vessels. But another is that the virus can directly affect it and infect the heart. And then, of course, your inflammatory response you have to the virus may also affect it. So all of those things make COVID-19 pretty dangerous. And I think it is much a heart virus is a lung virus. And I've written an article about that last September. And it really has been widely read, and no one's refuted it. Everything that we're seeing coming out of the literature right now indicates that heart disease is a major problem with this virus.
And this is James. Hey, James, thanks for holding. You're on with Dr. K.
Thank you very much. Jack, what I'd like to ask Dr. Kavanagh is I had COVID twice, and the first time, it was really bad. The 3 days thing, the shortness of the breath, the diarrhea, the sickness, and throwing up. And the thing about it was I got heartburn so bad, and I tried everything. I mean, Rolaids, I tried sitting up, doing all the old things, and nothing would stop it. Yeah. And I could feel my heart kind of getting that. But, I still have some of the cough left. I still have a few problems here and there. And that was a year ago, April.
And did you say you had it twice?
Yes, sir. The second time I had it, it only lasted 2 days. And it wasn't as bad.
Okay. What do you say, Dr. K?
Well, that's one of the things that we're worried about is people are having long-term symptoms. I remember I think someone call up or talk to me about, I know 30 people, none of them are short of breath. Well, yeah, but I've got 2 of my friends that are on heart medication because of arrhythmias after COVID. They're not short of breath, but they're taking heart medicine. And I also have some friends that are chronically short of breath or have a chronic cough. And this is a problem. And this is also one of the reasons why we're worried about this Indian variant, which if you go to outbreak.info, and that's a CDC-funded nonprofit that is tracking the variants, you can see that they're rapidly increasing in the United States. And this is the immune escape variants, the Brazilian and also the double mutation Indian variant. And so these are concerning statistics because they may not kill you, but you can still get severely sick, and it may take you a long while to get over the illness. And so I do not think at this point we should be going back to where everything is normal, or England has not gone back to entirely normal. They have less than 20 deaths per day right now in the United Kingdom. They're very worried about the Indian variant in those areas where the variant is spreading. They are advising people to continue social distancing, restricting large gatherings, and testing everybody twice a week. I mean, everybody. And that's what they're advising. And so we're not doing nearly as much as what a lot of these other countries are. I'm not saying that things are going to happen for sure that are very severe for this country, but why take the chance if we have the knowledge and we have the ability to make sure that we have a good defense against these variants? Let's take advantage of it. And by far, get vaccinated.
James, assuming that you've had it twice, I assume you have the antibodies. Did you get a vaccination?
Yes, sir, I did.
Good.
Yeah.
And there's a lot of confusion about the vaccination. Remember, the vaccination is to the wild type of the virus. Now, there's the original strain. And the idea with if you're infected, you get a vaccination is to boost your antibody levels very high so that you'll have some protection against the immune escape variants. It's not designed to protect you necessarily for the original virus, although it will do that too. The main concern is on these immune escape variants, which unfortunately are starting to spread in the U.S.
I appreciate your call, James. I hope you continue to improve.
Yes,
Well, brother, I appreciate you.
Yes, appreciate you calling in, sir.
Thank you very much. Okay, just a couple of minutes left now. I'm going to give it to you. What do we need in the near future? Just keep plugging vaccinations, right?
I think just keep plugging vaccinations for everybody. I mean, that's our ticket out of this. And when you look at the national statistics, you have to remember that's not your community. If your community only has 30% vaccinated and people are intermingling, you're going to be a setup for one of these immune escape variants. And the whole idea of, well, if I survive it, everything's okay, probably not a good measure of what good public health is. We want to make sure that we don't have lasting symptoms, that we don't have severe disease. So let's take some simple precautions. If you're not vaccinated, be sure to wear a mask and try to get vaccinated. I mean, it's crazy when you have countries around the world where thousands, actually tens of thousands of people are dying because they don't have a vaccine. We have excess vaccines and we're not using them. So let's all get vaccinated.
Sounds good to me. I hope you have a good weekend. It is always a pleasure to talk to you, sir, and we will talk to you again on Monday.
Thank you very much, Jack. Bye-bye.
Yeah, Dr. Kevin Kavanagh. He is a retired physician and founder of Health Watch USA. It grew from virtually nothing to a pretty influential nonprofit organization today.